Good afternoon. Thank you. Welcome, chamber members and guests. Thank you for joining us here today. It's wonderful to see all of you in person. And I say that every time, but you know, during these times, it really is wonderful to see all of you. I'm glad to see you and glad that you're here. And so thankful for the convention center. We couldn't do these lunches without them. See how you're all spaced out like we were back last March, so you can feel safe. You're far apart from each other and from the people behind you. Safely served, it's all good. You can feel, and do thank when we have Jim Doughton. Where'd you go? There. Jim runs the convention center, and he does a great job supporting our chamber. So thank you. And I also have some other folks to thank. We have Susie Hoffman, who is our manager. She manages all of the membership. And Ashley Muse is our new, well, not so new anymore, our office manager. And she's doing an awesome job and taking on some new roles. So we're very happy to have her.
Thanks, everybody, for joining us today. We're proud members of the Sharonville Chamber for a long time. And we know that they're great for our business community. So kudos to Lois and her team. And thanks for setting all this up safely for everybody. We are seeing the numbers tick up in the healthcare space, so you know, a lot of us are taking precautions, tightening up our mask wearing and all of that in all of our facilities. We'd like to thank you for being here today. Just quick notes about Beacon. We're on a huge growth trajectory. We have 16 locations now in the tri-state and 1 location in Dayton, and we have plans to open up about 10 more facilities in the next few months. So you'll see Beacon continuing to grow around town. And then we are now part of a parent company called Ortho Alliance. And we're talking to groups all over the country and trying to manage them centrally right here based out of our office in Sharonville. So pretty exciting. There's about 5 other big orthopedic groups in the country looking to do the same thing. So there's going to be some competition in that space, but we're talking a lot of groups. And we'll grow the brand under a parent company called Ortho Alliance. And because of all that growth, Beacon is hiring. We have a ton of positions open right now, from management to accounting to medical billing, front desk. So if you know anybody interested, tell them to go to our website, apply for jobs on our website. And if you have friends, family members, some positions do not need any college degree. So, you know, a lot of the positions do need certifications, but we do have positions that don't even need a college degree. So you have recent grads looking for great opportunity, getting paid well. Tell them to go to our website. Thank you all very much.
Thank you. I'd like to invite Greg up to the podium. Greg Kesterman has been with the county's public health since 2006. Lots of different roles. I won't read them all. The important part is that he was serving innocently as the interim commissioner when, boom, everything happened, and ended up in July becoming the health commissioner. And I'll just say this part. You have a budget of 17,480,000 citizens in 45 political jurisdictions. That's a lot of folks, including, as you know, Sharonville. So we're happy to have you here. And I will turn this over to you.
Excellent.
Thank you for joining us.
Thank you very much. So Lois actually stole my first slide, which was a couple of those statistics. I do want to start off by saying we can make this as informal as you like. So if you have questions throughout about the data that I'm sharing or something that I'm sharing, feel free to interrupt. I'm happy to take those questions as we go. Today, I hope to cover a little bit about who we are as an agency, which Lois helped me out on a little bit, talk about an overview of the disease and some of our local response, so some of the activities like the complaints and our response to testing when first testing was available, and then talk about current data, so where are we at today, and then lastly, vaccinations and some of our vaccination efforts. I will share these slides with Lois after the presentation, so she, if she'd like, can distribute them so you'll have a copy. So once again, Hamilton County Public Health, we serve all of Hamilton County except for Sharonville, Norwood, and Springdale. They each have their own health department, and as Lois indicated, we have about 480,000 people that are within our jurisdiction. Unlike many other county employees, I am served by a Board of Health. So a 5-member board kind of sets our policies and has the ability to create regulations and things within Hamilton County. This is advantageous in that if there are issues of political nature, I'm somewhat separated. So I don't report to the 3 county commissioners. I work closely with them and I talk to them routinely, but I am separate from the county commissioners. So just a reminder of our mission: Hamilton County Public Health educates, serves, and protects our community for a healthier future. So we operate a whole bunch of different programs to get to this point. We certainly have 2 departments, one Community Health Services that manages more of the medical services and the educational services. And the other branch of the agency is the environmental portion. So we do the nuisance complaint inspections, tattoo inspections, plumbing inspections in all of Hamilton County, and even some plumbing inspections and medical gas inspections outside of Hamilton County. There are so many programs. When I started here 15 years ago, I had no idea public health was responsible for. And if you've not had a few minutes to play on our website, I would strongly recommend it. It's fascinating, the different little programs and nuances of programs that we manage. Most of our inspection reports are found online, so you can hop onto our website, hcph.org, and you can see all of those inspection reports. So next time you're going to go out to a restaurant in Sharonville, they're up there online. Next time you want to check out a public swimming pool inspection and make sure that they're correctly chlorinating the pool and keeping you safe while you're swimming, it's available online. And I would always encourage folks to use that information to help make those facilities better. So if it's your favorite restaurant and they're not doing so well, let them know that you've checked out those inspection reports, and let them know that it's making you change your behavior. You're not going to go to this restaurant as often because of these reports, so that we can see some change. So, COVID-19 really came about pretty quickly. You think back to February a year and a half ago, and things started and materialized really quickly. So I put this timeline up as an opportunity to just walk through some of those beginning activities that we as a nation were kind of grappling with, and eventually it became more real at the local level. As a community and a country, we really did know very little about COVID-19 when it first appeared back in February of 2020. There were no cures, there were no vaccines, and there were, quite frankly, minimal treatments that we had. In fact, we were trying new things out each time that somebody got sick to figure out what was the best to keep somebody healthy or to get them to recover. The other interesting thing about COVID, it is actually in the same class as the common cold. So you think about how contagious COVID is, and it spreads a lot like a cold. It's respiratory in nature, and it spreads extremely easy, particularly in indoor environments, just like a cold. But it is a little bit different. It's got its own genetic makeup, and it turns out that it tends to be a lot more impactful with regards to the illness. So looking back, January 7th was kind of the beginning and the identity of COVID. We know it. We found out at that point, and we started naming it the 2019 N-COVID. So that was kind of the first classification we had of COVID-19. Quickly thereafter, though, by January 30th, the World Health Organization had declared a public health emergency. And right after that, the Trump administration issued travel bans to specific nations. Here in the United States, we did have our first case of COVID, you may recall, back in January of 2020, January 20th specifically, and that was in Washington State. And you may recall the news reports. It was kind of scary to watch. It was one nursing home that had one case, and it quickly turned into many, many cases within that nursing home, and ultimately many deaths. It was kind of an eye-opening event from my perspective. The first U.S. death, which happened at that nursing home that I just mentioned, happened on March 1st. By March 9th, we had several states with COVID-19. The World Health had declared a pandemic by March 11th. The U.S. declared a national emergency by March 13th. Our first case here in Hamilton County happened on March 19th, 2020. Pretty exciting day to be serving as interim health commissioner, finding out at like 2 a.m. about our first case. Really eye-opening, and a lot of work from my team to make sure that we were contact tracing and doing the work to isolate that case. Very shortly thereafter, though, cases were pretty much all over. By the 22nd, Ohio started issuing their stay-at-home orders, which I'll talk about a little bit more in the history, but they happened pretty quickly, as you may recall. Schools closed quickly. Right after that, we started seeing businesses and other implications around our community. So this slide I altered. My medical director, Dr. Fagans, actually shared it at a board meeting back in March of 2020. And it's from the New York Times, and it really talks a lot about the infectiousness of diseases. And so, there is so much misinformation about COVID. If you pick up your phone and you play on Facebook for a few minutes or Twitter, you're bound to find facts that aren't true. And one of those deals with, well, COVID's no different than the flu. And what this chart tries to do is it tries to compare different diseases and help put them into perspective. And quite frankly, COVID's got a big box. It doesn't have a little tiny point. And that's because treatments still vary. The effectiveness of treatments vary by country, and we're still learning quite a bit about COVID. And the variants complicate it too, because each variant is kind of like a new disease. We can call the Delta variant COVID, but ultimately it's its own new genetic makeup, and it performs differently in the community. So you look at seasonal flu, as you move to the, let's see, I think I have a pointer. As you move to the right, what this is saying is the disease is more contagious. So you think about yourself as a kid, chickenpox were widely known. One kid that got chickenpox was easily able to spread those chickenpox to a bunch of other kids in the classroom, and before long, the entire class was home with chickenpox. Good news is, generally speaking, chickenpox, pretty much nobody dies. It's right there on the bottom line, and it spreads and it does its thing, and it kind of fizzles out if the school did a good job of keeping separate classrooms separate, and we move on. When you go up this line, this is deaths. So the disease that I'll mention here is Ebola. So I guess 2014, we had all of the Ebola scares here in our nation. We were kind of concerned. Very similar to COVID, how it started off. Public health kind of took on this really strong quarantining pathway, and we were able to quickly isolate the couple cases that came to our country. Ebola, not very many people get sick from Ebola. Ebola is very good at spreading through body fluids, but you have to come in contact with body fluids to get sick. So the likelihood of me having Ebola and making someone at this front table sick are much, much less significant than a respiratory disease. The bad news, though, about Ebola, 1 out of 2 people who get Ebola die. So significant impact and significant response. So you look now at COVID, and essentially what this box is saying, and we heard mostly about Delta right now, and it's as contagious as chickenpox. So Delta is supposed to make about 8 people sick from one person getting sick. So you can see how exponentially, the first person gets 8 people sick. Each of those 8 people get 8 more people sick, which is 64 people, and it just quickly grows. And the death rate of COVID, of the Delta variant, is greater than 1. So 1 person out of 100 would, in theory, get sick and die. So the actual mortality in our country, I think I might have a slide, is essentially 1.7%. Now, that is a little bit of a messy number because we know that not everyone who gets COVID-19 is going to get tested, right? We've all heard of sick people who decide not to go get tested. This is a study conducted by the CDC, and it's helping us to understand how many people we know about. So in that top bar, we're essentially, for each person I find out through a PCR test has COVID, we know about 4 people probably had COVID, so only 25% are getting reported. So that can impact mortalities, but what we know is that of each person that we know that gets COVID, 1.7 will die. So there's a true impact. Now, once again, it's not perfect math because some of the disease is underreported. As you go down in the scale, we know that for every person that dies of COVID, we pretty much know it because you've been tested at the hospital. Now, there is always this other misconception. Folks say, well, they had heart disease, so they died of heart disease. And we try to brush them off like they didn't really die of COVID. But the truth is, COVID is what pushed that heart disease and caused them to die 1 or 2 years earlier in their life. So I just wanted to kind of put a couple things into perspective. All right, so I'm going to shift now. That was kind of like the the background kind of at a national level and a little bit about the disease. I'm now going to kind of focus on what we did here locally as things shifted and what our agency, Hamilton County Public Health, did in response to the pandemic. So local public health does have some ability to make rules, but generally speaking, the authority that I have as health commissioner, the authority that the Board of Health has and my team has, comes from the Ohio Department of Health and ultimately the Ohio legislature. So all of the enforcement that we did throughout the pandemic, whether it was a business closure or a mask requirement early on in the pandemic, it all came from the Ohio Department of Health. Our agency, I'm sure Paul remembers this line when we were up here presenting and talking about the changeover to Hamilton County Public Health, but ultimately we believe in education over enforcement. Time and time again, if I'm in your restaurant and I'm doing an inspection, our goal is to educate the operator. We know there's turnover, we know there's lots of new employees, and we want to make sure folks know the right thing to do. And so we held that same mantra when we were doing enforcement for COVID-19. By golly, I'm in public health, I'm the health commissioner, and I could hardly keep track of the changes because every other day there was a new enforcement regulation. So our team worked really hard with all of our businesses to make sure that they knew what was expected. We work closely in the region as well. You heard me say on the beginning slide that there were 4 health departments in Hamilton County. We wanted to make sure that our message at the county level matched the city of Cincinnati. Your next door neighbor in Springdale, their message matched ours. We wanted for consistency, so we worked really closely together. And then ultimately, we did a lot of this work through our food division. We kind of slowed down some of those activities as restaurants were closing and used that same team to get this work done. So how did looking at the entire year of COVID response, what kinds of activities did we do? We always responded to each complaint initially with a phone call. As mentioned, often the requirements changed so much folks didn't know what they had to do, and typically a phone call would take care of it. Typically, if a violation continued to occur, we'd actually send an inspector out to the business. We'd bring masks to the business so they could put them out for customers or for their employees. We'd bring the required signs. Once again, it's all about education over enforcement. Really tried to work with our businesses. All said and done, we had over 3,000 individual complaints over the course of the year, and of those, only 71 resulted in notices of violation, and only 7 of them, after they got that stern letter, were sent to the prosecutor for additional follow-up, and typically that was resolved with a phone call. So I share this because our agency worked really hard with our businesses. It was not a pleasant time for anyone, whether you were regulated or whether you were an individual. It was scary. Lots of things happening, and I'm really proud of the work of my team. The other major tool that I'm sure everyone now is an epidemiologist at heart after watching the news solid for a year throughout the pandemic. The other major activity that we did was contact tracing. And contact tracing works really well at slowing the spread of disease. Now, it works even better when the disease shows its face really easily, like Ebola. If I know somebody has Ebola and I quickly can isolate that person and I can quickly look at the infectious disease period and I can quickly tell the people that have been around that person to stay home, we're extremely successful at slowing the spread of disease. The same holds true with COVID, but as we now know, COVID was spreading among healthy people. COVID wasn't always showing its symptoms, and so the process didn't work perfect, but it did help flatten that curve. So you may recall that kind of mantra of the Ohio Department of Health was trying to flatten the curve. We were successful at doing that, but not as successful at completely smushing out COVID as we might have hoped. So we handled over 50,000, so this number continues to rise. I think we're at 68,000 cases today, my agency is. When I put this slide together, we had done over 50,000 contact traces. So we managed cases, and each one of those cases had people that were close contacts and required a phone call. Our agency grew with 120 contractors to help us manage this caseload during the peak of our work. So we expanded, we figured out ways to work from home, we figured out ways to bring on contractors with cell phones and laptops, and they would do this work not in the office because I didn't have space for another 120 employees. But we got creative. And what was really great about contact tracing, particularly at the beginning, is sometimes our team, particularly for senior citizens, was the only communication that a senior citizen might have had during that 14 days that they were stuck at home. Our staff would call them and they'd chat with them and they'd talk through their symptoms. And sometimes those 5-minute calls would turn into 20-minute calls, which, it's not ideal from a business perspective and trying to get the work done. But we actually looked at that as a great opportunity to make a touch point and to help that senior citizen through their difficult times. We also, as the disease progressed and as COVID-19 became more polarized, we certainly felt some of the heat from people saying, I'm not going to share information with you, and we're not going to work with you, and even some hateful things were said to my team. Now, as things shifted, though, you can only imagine the impact of contact tracing decreases. So I just think it's important to realize that contact tracing is effective when people work with you and when they identify close contacts, but if people become hesitant to do so, then we see the disease spread at quicker rates. So as the disease progressed, you may recall, this is kind of shocking once again, but back March and April, we really did not have resources for testing nationally. The ability to get a COVID test was extremely difficult. You had to meet very specific definitions, and really in the first days of COVID in Ohio, probably less than a dozen people were tested. Eventually, the testing in the United States became more available, and so testing picked up in Hamilton County. We were fortunate to partner with the Ohio National Guard, and we would set up testing events where folks could come to us and get tested and have access to testing at no cost. We ultimately, the governor, during a press conference, identified locations that he wanted testing because of high spread of COVID, including in Forest Park up this way, Colerain Township, and a few other communities. So we set up locations and we worked through some of the hiccups that we had no idea would occur, but we were able to test. My favorite picture from that period is this picture here. This is one of our first events testing. This is in Forest Park. I think, I forget what business this is at, but you can see the line of traffic and just how desperate our population was to have access to testing. This is the first time in Hamilton County that somebody could get tested without meeting a prerequisite of requirements because of exposure and travel and contact. So this is the first time we can give somebody reassurance that the sniffles they have are not COVID, or in fact are COVID. So really, we've come a long way since then. I was chatting with a few folks from Sharonville before the talk today, and there is testing available at libraries. Sharonville has got some of the Binax Now rapid test kits. So if you're looking to get tested, the opportunity is free, it's easy, it can be done at your home, and it's accessible. And quite frankly, the number one way still to stop the spread of disease is through testing. If you have the sniffles and you dismiss it as allergies and you go to work tomorrow, the opportunity to spread COVID hasn't changed. It still exists. Even if you've been vaccinated like myself, you still run the risk of spreading COVID. So I pause mid-presentation just to remind folks, take advantage of this great resource and make sure that if you feel sick, you get tested. Along that same line, we were fortunate, our Hamilton County commissioners certainly believe in COVID and have certainly been an amazing partner to Hamilton County Public Health and our community. Never once have they questioned COVID-19, and they have put significant resources to helping businesses recover, to helping tenants stay in their homes, to helping homeowners prevent the loss of their home, and in this case, to making sure testing is available. So with ease, you can go to the Test and Protect website, and you can find out where testing is available for free. But since I'm speaking to the businesses today here, you as a business can request at no cost that the Test and Protect program come out and do testing at your workplace. So they'll come out with a team of nurses and they will provide testing. And it's been paid for already by the county commissioners. This program goes at least through the end of the year, and it's been excellent. Tests are the PCR tests. They're typically turned around in 10 hours right now. Early on it was 3-4 days where we've fixed those problems. So a great resource. I would highly encourage you as we talk about Delta and we talk about the spread of COVID-19, I would encourage folks to take advantage. Yeah.
Which one's the PCR test?
So the Test and Protect is using the PCR test. The PCR test is notoriously known for that deep nasal swab, but it has changed. And actually, I believe now they're using a shallow nasal swab, and it's actually run on a machine, the PCR machine, which I don't know what that acronym stands for, but it's looking at the chemistry of COVID, and it's pretty definitive that if it comes back positive, that you have it. The Binax Now test kits are also pretty good, but not anywhere as close as the gold standard, which is the PCR test. The last slide then I'll show before I get into kind of where we're at today talks about public relations and some of the efforts that my media team did throughout the pandemic. Obviously, COVID had a lot of public interest, and so we wanted to work as a team to make sure we were being as transparent as possible and making sure that we could get information out as quickly as possible. So our website went through several revisions. We actually have translators on our website, so many different languages are able to be accessed. We tried to keep data up to date 7 days a week so that folks could see how many cases we had within our community, what the vaccination rates are. We really did a lot of work that way. Ultimately, we saw over 1.5 million page hits on our website, so a lot of public interest, and that was in 2020, and that compares to a couple 100,000 unique hits the year prior. So I really give thanks to my PIO team. They're really managing and a shifting world of information, and they do manage stuff on social media, which has been interesting. As all of us know, social media has been a very difficult landscape to work in, but our team has really done a good job and worked through that. So where are we today? And if you've seen anything that I've done publicly over the last 6 months, this slideshow, the next few slides will seem fairly familiar. Here, this is actually straight from our website. We have 86,000 from the beginning of the pandemic, 86,375 cases of COVID. I like to look at it, though, more from how many are active cases of COVID within our community. And so that is the 86,000 minus the presumed recovered. Presumed recovered means you've had COVID for 21 days. And most people, unless you're in the ICU, have typically recovered enough that they're no longer shedding the virus. So at this point in Hamilton County, we are up to 4,700 active cases of COVID-19. So that's pretty much. About a month ago, we were down to about 1,400 cases. So we're heading in that wrong direction. And even more telling is this slide, which shows kind of our trend of cases per day. So this is a 7-day average, the orange line is, and a month and a half ago we were down to 13 cases per day, and now we are at 202 cases per day. So wrong direction. And once again, cases can lie. The numbers aren't perfect. Not everybody's getting tested. This is probably just the tip of the iceberg. In a moment I'll show you hospitalizations. Those don't lie. When somebody gets sick enough and they need to go to the hospital, they're there because they have COVID. It's pretty equal. The same holds true with flu. We look at flu the same way each year. You know, most folks don't report the flu. Most folks deal with the flu at home. But in the public health world, we spend our time looking at flu hospitalizations because at some point, somebody with the flu that ends up in the hospital, it's a pretty clean and easy benchmark to look at. So I'll talk about that one more moment. Last year, flu in Hamilton County was almost zero. And we blame that on these masks that I hear folks say don't work. We know that last year in Hamilton County, flu hospitalizations were almost not heard of. And that's the truth. Our hospital system still tests for flu. They still test for COVID. We know who ended up in the hospital. It's not a mystery. It's not made up. It's science. And we know that the flu was not here last year anywhere close to how it's been in previous years. And that data is available on our website if anybody ever wanted to dig in and see those comparisons. Positivity rate right now is increasing. So you think about positivity rate, the bottom line represents folks who are choosing to get tested. You can see the number of folks that are getting tested right now is increasing, which is a good thing. So the COVID is spreading in our community and folks are making the decision to get tested again. And of those folks that are getting tested, just about 9% are coming back positive. So what this means is a higher proportion of our population has COVID-19. And so just one of the many metrics that we're kind of looking at on a daily basis. Similar to reproductive value, I know a lot of folks like this number. It's really just another indication on, is the pandemic spreading? For the last month, the reproductive number has been above 1. Today it is, I can't see it on the screen here, 1.17, I think. Yeah, 1.15 for the county and 1.17 for the 14-county region that we are a part of. But most significant is for the last month, the pandemic has been growing in size. So hospitalizations don't lie. They are heading in the wrong direction too. Right now in Hamilton County, or I should say in the 14-county region, we have 303 people within our hospital system, 87 people on ventilators within our system. Why do we look at it at a 14-county region? And we do this because we load share. When you see hospital downtown in Clifton gets really busy, the first thing they do when they don't have capacity is they shift patients elsewhere. And so this 14-county region has been working together for more than a decade on preparedness exercises. When hospitals in Brown County get busy, they shift to Hamilton County or to Claremont County, and we work as a region to make sure the entire region has the necessary capacity. So at this point, we are not at capacity in Hamilton County. Our systems are nervous. We are heading clearly at an incredible rate in the wrong direction with hospitalizations, but we're not at capacity. We are load sharing. We are seeing hospitals shift patients. Some of that is due to staffing. Yes, hospitals are having a hard time with staffing for many reasons, but they are certainly nervous. And if that line continues at that rate, you can only imagine how quickly we'll get out of control. For reference, so today I mentioned we're at 303 folks within our hospital systems. In December, we were at 800. So we're not there, but certainly not a pretty picture. What's unique this time around, though, is the age shift. This is from the Ohio Hospital Association's website, accessible to anyone. You can see this time around, we're starting to see more people that are in the ages of 40 to 70. So more younger folks are getting sick with COVID this time around. And that's most likely in large part because that population is less vaccinated. So we know almost 80% of those over the age of 80 have been vaccinated. We know that many less 50-year-olds are vaccinated, and I think it's playing out here. The other thing that I think is incredible is that the vaccine is working so well that people who are vaccinated hardly get sick. And that's this whole concept of breakthrough cases, which I'll talk about in a second. But in general, if you've been in the hospital, 98% of those individuals in the hospital have not been vaccinated, which means only 2 out of 100 folks have been vaccinated and are part of that breakthrough that we hear so much about. So right now in Hamilton County, we are using the CDC's color code system. So throughout the pandemic, we talked about the Ohio Alert System and people talked about colors. So this is the Ohio Alert System. It had 7 metrics. You heard me talk about it, and many folks talk about it. We were orange for a long time, then we went red, and there was the purple where what would happen if you went purple? All of that's gone. We are now, and that's because the governor did away with it. We are now using the Centers for Disease Control map, which has all of Ohio looking pretty dire. It's really based on only 2 metrics. The first metric is cases per 100,000. If you're over 100, which we're at 178, then you are considered red. And also, it looks at percent positivity. We are at 8.45. If cases weren't over 100,000, we would be red we would be orange because of the percent positivity. So it's much simpler than the Ohio version. What happens, though, this time around, in part because of legislation changes, there's no mandates. So I wouldn't plan on any business closures. I wouldn't plan on any mask requirements or mandates from the Ohio Department of Health. The Ohio legislator, through, I think, Senate Bill 22, has essentially taken a lot of the power away from the governor and the Ohio Department of Health to issue mandates. And so this time around, you're going to hear a lot more recommendations. And so Hamilton County Public Health is going to align with Ohio Department of Health and Centers for Disease Control on what we would recommend you do to help keep your businesses safe and to help keep your family safe. And so these 4 little pictures here is the same message I've talked about now for a year and a half. Wash your hands. Just generally speaking, encourage people to have good hygiene, right? It's basic public health. It's how you keep your family safe during flu season and COVID season. Why not? If you feel sick, we ask you to keep it at home. We've added the masks because we know masks work. And then we talk about social distancing, although a little less this time around as many more people are vaccinated. But clearly distance does play a major role in protecting you from illness. And then probably the most important thing we have right now is the vaccine. So if you've not been vaccinated, we strongly encourage you to. If you know someone who is not, we strongly encourage you to put some effort into talking them into getting vaccinated. So I'll touch on breakthrough cases then. This is published on Ohio's website. Hospitals are required to report breakthrough cases in Ohio, so we know when folks die from a breakthrough or are hospitalized. We do not have a good count on those individuals that have COVID and don't end up hospitalized. I think it's important to note that we did know from the creation of the vaccines that there would be breakthroughs. You may recall the vaccine, for example, Moderna was supposed to be 95% effective at preventing COVID. What that means is we know 5 out of 100 people will still get COVID if they take Moderna. That's considered a breakthrough case. We know that from day one. It's only 95% effective. What it's really good at doing, just to reemphasize this, is keeping you from developing serious illness. So you just heard me say 98% of people in the hospitals haven't been vaccinated. Well, even if you get COVID, typically you're not ending up in the hospital. So what does that look like as far as breakthrough cases? We know that about 1.9% of people who have been vaccinated end up in the hospital. And we know that 0.97% of folks who have been vaccinated are passing away from COVID. And these are of known cases of COVID, right? So it's the tip of the iceberg probably. It's probably less than this, but this is based on actual data. It's actually just the two numbers divided. So we are now starting to talk about boosters and things like this. There's a lot of media reports, and the president was referencing as soon as September we might be seeing boosters, and that's based on this data. We know that boosters will help give it that extra bump and help protect the population. So let's move to something more happy than cases of COVID and the depressing stuff that we all thought we were finished with. Let's talk about vaccine. We as a population, when you omit those under the age of 12, we are at about 61% of our population vaccinated. Our goal, the national goal is 70%. Our regional goal was really 80%, and that's because the more folks that are vaccinated, the more immunity you're creating as an overall population. When you include those that are under the age of 12, we're about 53% vaccinated here in Hamilton County. So a long way to go, but we'll take every little success. There are certainly counties in Ohio that are much more vaccinated than Hamilton County. I think Delaware County is pushing 67% vaccinated, but there are also counties that are much less vaccinated, including many rural counties that are still struggling at 35%. Good news, though, is each age group, week after week, is out there getting vaccinated. They're low numbers, but each week these lines representing the percentage of vaccinated individuals in each age group continue to increase. And the percent change week after week, we are continuing to see, particularly in the younger groups, a greater increase in change of vaccination rates. So these are the folks over at Princeton School District that are over 12. We're seeing kids getting vaccinated as they're heading back to school. We're hearing coaches encourage their teams to get vaccinated so they don't have to quarantine and they can continue to play ball. And I think we'll continue to message that vaccine is the golden ticket here. I mentioned before to somebody, but we are getting ready in Hamilton County, at least at our sites, to offer a $100 gift card. We actually have some dollars from the state of Ohio. And so if somebody's not vaccinated, starting I think next week, they can come to one of our mobile sites, including one that we do here in Sharonville in front of the convention center, and get $100 to go spend on what they want. So just another tool to help increase our overall population's vaccine uptake. And as mentioned, we're really proud of those over the age of 60. We've hit that national goal. You look at those that are 70 to 74, we're over 80%, almost 90% vaccinated. Once again, this is materializing into less folks in these age groups ending up within our hospital systems, which is great news and clearly one of the major benefits of this vaccine campaign from day one. So as mentioned, we are talking about round 3 of vaccine, and I think what's most important as we hear all of these statistics from folks about serious illness from COVID-19 and some of the negative impacts of vaccine, we as a country have done an amazing job of tracking COVID vaccine. The VAERS, the Vaccine Adverse Events Reporting System, is able to be used by anybody who gets vaccinated and is a tool where people can enter in their own personal interaction with the vaccine. Did you have diarrhea after getting vaccinated? Did you have headaches? Were you out sick for 3 days? You type this information into this VAERS system, and we can track and learn about how well the vaccines are doing. And this is the data that we use to drive decisions about encouraging pregnant women to get vaccinated. This is the tool that we're using to help say, yes, it's probably about time for a third vaccine. And this is the tool that we're using to pause vaccine like we did with J&J because of a few adverse events that we wanted to learn more data about. Unfortunately, sometimes with data, especially when you're transparent, people can take that data and extrapolate negatives that are also happening. And they assume just because the negative got reported in VAERS that negative is a result of the vaccine. So one other social media item that I'd like to discredit, you'll see somebody say, so-and-so, my grandma who's in the nursing home got vaccinated, and 3 weeks later she died from a stroke. And she must have died from the vaccine because she just got it 3 weeks ago. But what we know is that 80-year-olds have strokes. And we know the rate of 80-year-olds having strokes. And with enough data, we can see if that changes over time. Because if more people are having strokes that have been vaccinated, and we compare that to the baseline, then we do have a problem. But that's the power of VAERS. If you've not used it and you get vaccinated and you type your data in, we have the data to help suggest and to help learn from the vaccine. And what we're seeing is no adverse impacts from COVID-19, minus those few extremely rare instances that we hear about with like the J&J vaccine when we were talking about rare seizures and things of that nature. The last slide I have here talks about in our community, talks about vaccine sites within our community. Here in Hamilton County, we have over 200 sites at this point throughout Hamilton County. All of the blue dots represent locations that you can just walk up and get vaccinated. So if you know somebody that's been hesitant, you can encourage them to go to Kroger's, Walgreens, one of my mobile sites, including, as I mentioned, here in Sharonville, and get the vaccine. It's really easy to do. We know it saves lives. We know it's making a difference. And then I'd like to just conclude really by saying thanks to Sharonville. You guys have been a great partner throughout the pandemic. This room was actually a vaccine clinic when we were doing large clinics. We've been parking in the parking lot out front and running vaccine clinics. We set up in a manufactured home park and made a big difference. And quite frankly, some of the work that Sharonville did to help promote that event made it one of our larger events at a time where we are seeing less uptake of vaccines. So we really appreciate the partnership. I appreciate the opportunity to be here.